Oh, hi. I'm Dwayne. Hey, Shelby. Oh, excuse my friend here. I'm just administering a little cam therapy. Shelby, say hi.
Hiya, I'm Shelby, and I think what my friend here meant to say was since he's not yet a nurse, he is offering me treatment that does not stem from mainstream medical practice.
Hey, Shelby, actually these techniques can and quite often are used in conjunction with most conventional medical therapies. And I will soon be a nurse, by the way.
Yeah, Dwayne, sure you will. But how about we take time to explain a few examples of these? I will start with reflexology since that was what they saw you doing.
Okay, Shelby, go for it.
Reflexology is intended to lessen generalized stress and help the body reach a state of deep relaxation and homeostasis. It is an ancient healing arts used by the Egyptians dating back to approximately 2300 BC. William H. Fitzgerald is credited for contemporary reflexology. He was an American physician in the early 1900s and discovered that applying pressure to certain parts of the fingers may relieve pain in other parts of the body. Eunice Ingham is in the 1930s discovered that certain parts of the feet were more responsive to pressure and provided better pain relief than those in the hands.
Shelby, I knew you had a thing for me, but you can't see my feet.
Dang. Reflexology sees the body as being divided into 10 equal longitudinal zones. These zones run from the top of the head to the tip of the toes. The 10 zones are associated with the 10 fingers and 10 toes. It is thought that illness establishes itself in calcium deposits in equivalent parts of a person's foot or hand. The ear is also thought to have some pressure points as well. Pressing specific parts of a person's foot or hand may have multiple healing powers, such as stimulating energy movement, produce relaxation, reduces stress, promotes health by relieving pressure and accumulation of toxins in the corresponding body parts. Reflexology is also known to help manage chronic conditions such as asthma, sinus infection, migraines, irritable bowel syndrome, kidney stones, and constipation. Other symptoms that have responded well to reflexology sessions include phantom limb pain and anxiety. For nursing care, once the pressure points are learned, the nurse can massage the areas of the patient's foot and hand to relieve pain and produce relaxation. Pressure is applied by using a thumb and finger walking patterns, resulting in gentle stretching and massaging specific zones. People with open sores, acute injuries, active clots in the area, burns, wounds, gout, infection, extremity swelling, vascular problems, and recent surgical procedures in the area should avoid reflexology. It is also thought that rubbing of a pregnant woman's feet may stimulate contractions, so reflexology should be avoided in the late stages of pregnancy. Whew, that was a mouthful.
Oh, that's funny.
What's funny?
Is that a fruity drink by chance?
Yes it is.
You should really wash that down with some water.
Why?
Well, you are drinking from the dark swirl, which associates itself with shadows, death, cold, and danger.
Really?
Your drink happens to be associated with yin. Yin deals with balance and is on one far end of the spectrum. Yang, however, is on the complete opposite end of that same spectrum. In the case of what you are drinking, yang would be the water. It is the light swirl and represents brightness, passion, and growth. It sounds like the yang is all you need, but in all actuality, you need both yin and yang. It is said in our textbook, in the 1960s, macrobiotics became ever-growing because of the peak notice everyone was giving to more natural and spiritual approaches to healing the sick. It is a formulated viewpoint derived on principle of regulating your food intake equally. They use yin and yang to associate the good and bad qualities in our food. I mean, stop and think. Truly, you never see good without evil. You never see one without the other. When talking about food items, they both give you that balance that your body needs to survive. I mean, let's look at it for a sec. Too much water will kill you, but too little water will kill you also. You also have good fats and bad fats, but understand you need both to thrive. Another thing to account, too much alcohol is bad for any person, but one glass a day helps to fight heart-associated conditions.
You mean like this size glass?
Shelby, I think that's a little big. 6 to 8 ounces is the recommended daily glass.
All right.
All right. The real task, however, is not taking in too much of one or the other, but also making sure that each person, especially women and children, are getting the needed variety of nutrients and vitamins needed to sustain life.
Camp therapies have their benefits and risks. As nurses, it is our job to educate our patients on the importance of not supplementing necessary medical therapies for complementary alternative therapies.
A serious illness can be missed by only seeking CAM therapy and delaying the correct treatment. CAM therapy is best used with less severe conditions and in conjunction with medical interventions,
We would use these CAM therapies and recommend them,
along with others, to our family and friends only if they are appropriate for their health condition and status.
All this talk about food is making me hungry. I think it's time for lunch. I'm craving some Yang food.
Nah, Shelby, don't think I forgot. It's my turn now.
But you're not even in pain.
Oh yeah, my brain hurts.
Alright, let me see your thumb.